when I heard that I was invited to speak to you all and that I had 30 minutes, my first thought was, okay. And then I started putting things together and I thought, well, good grief, what do they want to hear that they, for instance, haven't already perhaps talked about or couldn't glean from the website itself. So again, I'd like this to be as informal as possible. I've got somewhat of an agenda, but please feel free. I know you all were pretty quiet for the last half hour, but please feel free to jump in as you have questions. I kind of look at what my remarks are going to be today as kind of the ODU School of Nursing's role in facilitating your path. And I think, let me see if I can get to my second slide. There we go. Can you all, am I advancing? Beautiful. So I thought that it would be appropriate for me to kind of fill you in on, what my path to nursing has been. Nursing was not a first career for me. As a matter of fact, it wasn't anything that I was considering at all. In the olden days, in 1981, I graduated at the traditional age from Randolph-Macon Women's College in Lynchburg. And that's when it was called that. It's actually undergone some name changes since then. And my major then, my interest area was in teaching, and in particular elementary education teaching. So my degree was a BA in an interdepartmental major, education psychology. And with that, I also got a special endorsement, which allowed me to teach a subject area, math in particular, at the middle school area. And so that's what I did. I actually got my first job teaching in Suffolk, Virginia, and I taught high school math for 15 years. But during that time period, I also felt the need to continue my pursuing education. And so I came to ODU and I got my master's in education and had an emphasis in guidance and counseling. So during that same 15-year period, while I was teaching, I was also a high school guidance counselor, and I thoroughly enjoyed that. But things happen, life things happen, and I had an opportunity to go on some medical missions with Operation Smile, if you all are familiar with that. And if you've ever done anything like that, you can appreciate the fact that those kinds of experiences really are life-changing. And that's kind of what happened to me while I was in Romania, working with students who were working with children who were anticipating surgeries. I really got inspired and came home and decided, maybe I'll start doing some prereqs. I already had, of course, another degree, so my gen eds were already completed, and I came to ODU in the School of Nursing and finished up here in 1998. And after that, went into the world of nursing and worked just down the street at Children's Hospital of the King's Daughters. I heard somebody mention that just a moment ago. And I worked there on what was then 8B, the Hematology Oncology Unit, for a number of years. Actually doing some bedside nursing, education coordinator position on that same unit, and then ultimately moving to staff development. There is method to the madness in my introduction as well, especially in terms of the path, because I think that many of you all feel like you know right now what it is you want to do and what you want to do for the rest of your life. And I think that is fabulous. That was not at all my plan, my path, my intention. And I think that either way we go about things, keeping our options open is particularly helpful. And I certainly have found, obviously, in my most recent educational experience, getting my master's in nursing in 2005 was really, the point of that for me was really to get the piece of paper, if you will, that supported what I was doing in terms of the staff development. And then again, best laid plans, as luck would have it, I was offered the job here in the School of Nursing as faculty. So again, just a way of helping you get a feel for who I am, perhaps the validation for why I even have any credibility to speak with you this afternoon. But again, more of the method to the madness, just keeping your options open. So one of the things that I find is that nursing has a plethora of opportunities for you to pursue. So here's a picture of me as well. There I am embracing ODU at the football tailgate there with my family. I'm that old lady on the left. The younger lady in the middle is my daughter who just graduated from ODU. And we're standing there on that property that is probably going to be, if I understand correctly, the new home of the College of Health Sciences. So kind of a bittersweet picture there. Oops, let's go here. So that's a little bit about me, and I wanted to know a little bit about you all. So I asked Ms. Garcia to tell me a little bit about your group. And there I understood a couple of things. Number one, you are larger in number than the people who happen to be with us today. However, about 20% of you all are interested in dental hygiene, one nuclear med, and then probably 3/4 of you interested in nursing. But what I also find interesting, and again, around which I'd like to direct my remarks, are the fact that I feel like I'm speaking to the cream of the crop, because you all obviously have demonstrated your academic soundness, the fact that you are part of the Honors College program or either guaranteed entry candidates or both, speaks to the fact that you are goal-oriented and you're up for challenges. So I certainly, again, applaud everything that you've done so far. I'd like to, if you'll engage with me just a moment, I'd like to kind of set the stage also by asking you a couple of other questions. So my first question is actually for the non-nursing intended majors. And if you were going to respond to this question, you know, what would you say? What is it about nursing that is not appealing to you? Perhaps not just that there's something else you want to do, but if you had to describe nursing and your pleasure towards it, and it was negative, what might be the reason? Anybody?
For me, like I've thought about nursing, but when it comes to like wounds or like broken bones, it really freaks me out. But for some reason, like teeth, like missing teeth or like messed up teeth, I find it so interesting. But if I see like a broken bone or blood, I kind of get woozy. So I knew nursing wasn't really for me.
That is a fair statement. That daughter of mine who just graduated from ODU, no way in this world that she could ever be a nurse. The thought of even those things, she doesn't even have to see them. She just thinks about them and she feels like passing out. So I know from firsthand experience how that can be. Anybody else? Okay, not going to put you on the spot. How about those of you, that 3/4 of the rest of you who at this point have determined that nursing is what you want to do? What is it about nursing that appeals to you?
I really like nursing because there's a lot of different like jobs and positions that you can go into with it.
Excellent. What else?
Well, I really knew that I wanted to work with people, but I like could not be behind a desk. So, and I'm not queasy about like the anatomy of things. So I just knew that I wanted to do something in the medical field.
So I'm hearing people-oriented, lots of variety, options. Anything else? Okay, well, we can go home because that really is kind of the take-home message, right? But no, we've got 20 more minutes together. So specifically, my objectives then in setting that stage is to kind of frame what we talk about next. Being able to maybe define nursing a little bit more, talking about not only what they do, but where they do it. And most importantly, I think why I'm here is to help you all understand what is ODU's School of Nursing's role in that plan. So I'm going to start with what I consider to be the not so easy answers. And the reason why I think they're not so easy is because there are so many choices. And that's exactly what you said. So the first thing, I've got, just the American Nurses Association definition of what nursing is on my screen. And I've highlighted a couple of words that also, in my mind, describe what nursing is, because I think even the few of us who shared have a picture of nursing, either the reason why we want to do it or the reason why we don't want to do it, that tends to be very physically oriented and not necessarily inclusive of other things that might be going on with an individual. And in saying that, we tend to think about those grosser kinds of things. So pains and bloods and things of that nature. But if you look at this definition, it's much, much broader. It's protection, and I've highlighted promotion and optimization of health. So very definitely we're talking about something in the health related field. It includes preventing illness and injury, alleviating of suffering through diagnosis, yes, treatment, yes, of human response, and I've highlighted that or put an asterisk by that I want to elaborate on, and advocacy. So lots of things in addition to obviously treating injuries or physical ailments. And notice the other thing, and perhaps one of the reasons why you all like sociology so much, the way we define who the patient is equally as variable. It might be an individual, but it also might be a family. It might be a community. It might be a population. So for me, this definition of nursing is really quite broad and certainly supports why it is that you are able to make the comment, the appropriate comment, that there's so many different things within nursing that one could do. So if you like to, if you are health related, which obviously we all are, or we wouldn't be in this particular class. And the idea would be to meet the person where they are. You could even argue that all of the other professions within the College of Health Sciences really do kind of have a nursing focus to them as well. We find that there is much overlap. That's why we do a lot of interdisciplinary planning. When I first went into nursing, my badge actually didn't say RN, even though that's what I was. It said patient care coordinator, because what we did was to actually coordinate the care, meaning interdisciplinary coordination of the different roles. So I do think this topic is appropriate for all of you, regardless of what specific field you choose to go into. Now, this word holistic, we use a lot in nursing, because it refers to all of those things that make a person be a person, and all of those ways that a person can respond to whatever is going on in their life. So we tend to, again, think of those responses as being physical in nature. So we have some physical, an illness that conjures up signs or symptoms, okay, or physical signs or symptoms that we might see. But it also certainly impacts our emotions, our social interactions, our spiritual interactions. So what nurses do is very holistic in nature, in that we pay attention to the whole person, and any way that they respond to what's going on in their life becomes what it is we focus on. So what we actually do, the specifics of that, really does depend on the role of the nurse. And by role of the nurse, I mean literally that label that we give to them. And it too is dictated by many things, most especially education. But that education, that training, the length of time certainly has impact on what we call standards of practice are. So if you have been educated in a program that produces licensed practical nurses, then your scope of practice would be different from those programs that educate registered nurses. And even when we say registered nurses, there are a variety of different pathways that can produce an individual who successfully completes the exam that would render them a registered nurse. And then beyond that, there are also advanced practice nurses. So what nurses do and where they do it and with whom they do it is dictated truly by virtue of their educational preparation. So let me stop there for a minute. I found, even when I went to ODU to nursing school, that I wasn't particularly clear about the different pathways for becoming a registered nurse. And I also found that certainly the lay public, let's just call it my family, was unsure about that as well. So let me just stop right there and say, I don't want to make the assumption that you're on that page too. Do you have questions about what I mean when I say you could become a registered nurse by going through a diploma program? You could become a registered nurse by going through an associate degree program at a community college. You can become a registered nurse by going through a BSN program like ODU. Are there questions about that first before we go further? Okay, so the take-home piece at this very point is that when we're talking about what nurses do, what the role is, there are many, many, many choices. And that's what I have found. It has been so beneficial to me in nursing is that sometimes things that you want to do, changes that you want to make once you're a nurse require extra education, but sometimes they don't. All of those things that I did at CHKD, I could do and move from unit to unit, and I can go from a children's facility to an adult facility to a psychiatric facility without necessarily getting additional education. So that's one of the fabulous things about nursing, I think, is that you can not only match what you do with your interests, but you can also match what you do with your family needs, let's say, because typically bedside hospital nurses work 3 12-hour shifts a week. Other outpatient centers might have the traditional 5 8-day-a-week schedules. You can choose to work nights, you can choose to work days, you can choose to work a combination of those things. So it really affords a lot of flexibility. And I didn't hear anybody mention that as being, a real carrot, if you will, for becoming a nurse. But it also, look around right now, it's job security. Because as you all were talking, COVID, nurses are needed, nurses get jobs. So if that's the big picture, those are all the opportunities that one has. What then, again, is the educational piece? Because that's really what we're here to take a look at. And so I call that really the easy answer, because I can tell you very specifically what it is that ODU's School of Nursing can do to facilitate taking you from where you are right now with your interests and facilitating that path for you, or at least helping you discover the path that will take you to whatever role in nursing you want to do. So the first thing I've put on the screen here is a picture of our facility, because the ODU School of Nursing, although it's a part of the College of Health Sciences, is not located on main campus. It is not located within the current or even the expected College of Health Sciences. We are actually in the Virginia Beach Higher Ed Center, which is on Princess Anne, right across from the amphitheater, LifeNet, Centera, Princess Anne Hospital. And we share this facility with Norfolk State. However, more often than not, their classes are at night, and so we feel like we have the entire facility ourselves. By moving out to this facility, we have not only created our own little community, but we've increased our space significantly with respect to our skills labs and assessment labs and simulation opportunities. We have state-of-the-art mannequins, high-fidelity mannequins, and all of these things help to facilitate the knowledge acquisition as well as the experiential learning that go on in nursing education. At ODU, in the Bachelor of Science in Nursing program, there really are 3 potential programs. My assumption is that you all are our candidates for the pre-licensure program. And so that's ultimately what I'm going to be focusing on in our final slides. But we also have a concurrent program. So in that program, students can go through one of our partner schools, typically the Virginia Community College System schools, and take the courses that prepare them to sit for the RN licensure exam, and then come to ODU, actually simultaneously working at ODU, in some baccalaureate courses that are really above and beyond the nursing courses that teach the knowledge and skills. So these would be some of the courses in leadership, research, community health, expanded courses, things of that nature, nursing informatics, policy and procedure. So some things, again, that aren't necessarily need to know for the registered nurse NCLEX licensing exam, but are certainly good to know with respect to how to work in the world of nursing. It is still the objective for all RNs to have a baccalaureate degree. It has not yet been attainable, and so it is possible you can absolutely work as a nurse having come from one of the other programs. If your desire is to advance into those advanced practice roles, then one would need the BSN. So that's why many students will choose the concurrent program. They gain access to the licensure exam, can practice as a nurse while continuing their education, and again, ultimately end up with the BSN just on a different schedule. We also have a post-licensure BSN program. These are for those individuals who have already completed their RN programs, have probably been practicing as a nurse for some time. And again, because of that desire for all practicing nurses to have a BSN, have chosen to come back to school and again, take those good to know courses that facilitate their practice as a nurse. So that's what we do in the bachelor degree program. 3 options, again, depending on pathways, financial aids, monies, desire, time, all of those kinds of things. We also have a number of master's degree programs in our School of Nursing. One can become a nurse practitioner, a clinical nurse specialist, a nurse midwife, and in a variety of different areas that I've listed there. Again, many students come into nursing thinking, I want to be absolutely this. And quite honestly, many times they want to be that nurse anesthetist. And that might have to do with skills that they're interested in. It might have to do with work hours that they have. It might have to do with monies that they want to make. But people tend to look at nursing and have a feel for where they're headed. There is no specific time frame or path that one needs to take. So, you know, if you don't have those specific goals at this point in time, or your goals are, I want to be a bedside nurse for 50 years, absolutely fine. All of those things are attainable in the ODU School of Nursing programs. We also have opportunities for DNPs, so doctoral degrees, and those are available for advanced practice, nurse executive, and nurse anesthesia. So those leadership and very specific areas of practice are afforded in our School of Nursing as well. So all of these different programs are housed, if you will, in our Virginia Beach Higher Ed Center location. Any questions? All right. So the real nut and bolts is, if I'm reading you all correctly, you all are already, as I said, the cream of the crop. You've demonstrated your academic abilities, and you are goal oriented, and at some point in time, when your general ed courses are complete, when your nursing departmental courses are complete, you're going to be ready to apply for and get accepted into the ODU pre-licensure BSN program. So what does that program look like? I can tell you what it looks like today. I can tell you what it looked like, when I was there. I can't necessarily tell you what it's going to look like tomorrow, because as you know, actually our mantra in the School of Nursing is fluid, because flexible is too rigid. So currently, what we do is to run our 66 credit program, the BSN components, over 5 consecutive semesters. So individuals apply in February, they're notified of acceptance in March or early April, and they plan to start in the program in the fall. So they would go fall, spring, summer, fall, spring, graduate. We offer in the pre-licensure program only, I call it a face-to-face lockstep program. Some of our classes are online, but we're trying, even during this COVID experience, to offer as many face-to-face opportunities as possible. And we've had to be a little bit creative. Fortunately, we have had that luxury since we are on the Virginia Beach higher ed campus, because we can use classrooms, we can divide our cohort in half, we can teach things twice, we can alternate weeks. We have been very, very creative to ensure that our students get not only the high quality didactic experience, but also the opportunity to create that community. Because whether we're a community of nurses or whether we're a community of interdisciplinary team members, a community is key. This is not a program or a profession where you can ever have attained all of the information that you would need, because we're evidence-based, we are research-based, we are theory-based, and so that is always an ongoing changing facet of this particular aspect of healthcare. We offer, again, courses didactically, meaning face-to-face in classrooms. We also have a few that are online. We also have somewhat right now that are hybrid. So we're face-to-face on alternate weeks. We're online either synchronously or asynchronously on alternate weeks, and always face-to-face with our skills lab and our simulation and our clinical courses. And the way these things have changed in light of COVID is we're not only masked, we're goggles is what I'm trying to say, or face shields, certainly gloves, all of these kinds of things above and beyond what the university has required for other classroom situations. But it's imperative, because you can't learn these things by simply watching a video or reading a book or even listening to a lecture. You have to experience working with individuals and experience the skills. The other thing that's important to learn is that we in the School of Nursing in the undergraduate program are creating generalist nurses. So again, that means that when you graduate from our program, you are poised and ready to take the NCLEX exam that would validate your ability to practice as a registered nurse. But just graduating with the BSN does not necessarily facilitate that. In other words, you cannot, as in many other disciplines, graduate and then just start to practice. You have to demonstrate this knowledge by successful completion of the NCLEX. So it's the biggest test that you ever have to take, outside of the ones that you take for your classes, because it really does determine when you can enter the profession. So we're quite proud of the fact that our first time pass rate is 93%, which is well above the national average. So coming through our BSN program, you can feel as though you are as prepared as possible for that particular exam and ready to go to work. I've listed, I know our time is running out, I've listed on the right-hand side of this slide what you probably already know from your advisors. The application process is extremely competitive. Again, that is not to scare anybody, because again, I know I'm speaking to the cream of the crop. We look at those courses you've taken, especially those ones that we require. We look at that GPA, we look at test scores, and we look for experience. And the experience is not defined. It doesn't have to be anything formal or official. It can certainly be volunteer. And quite honestly, the purpose of that desire, and like I said, it's not required, is so that you can get in there and see, this is nursing. I really don't have the stomach for it. Or yes, this is exactly what I thought it was going to be. So to help you better gather your data so that you can make an informed decision, establish those goals that would help you design your own path, and then again be able to evaluate your progress towards completion of the program. So I conclude with just saying to you, ultimately, do exactly what you're doing right now. Continue to ask questions. Continue to recognize, yes, it may have been a rocky start, but things are getting better. I heard some of you all say that. And to maintain that attitude of lifelong learning, because if you're not interested in having an advanced degree, you still need to have an attitude of lifelong learning, because as I mentioned, research, evidence-based, healthcare itself in general is always changing. And the more we do, the better we know, and the better quality care that we can provide. So that takes me to the end. I'm a moment or so over, and I apologize for that. I would certainly welcome any questions, comments, concerns, but I've also provided my contact information. I'm happy to address any questions that you might have by email later. So thank you. Any questions for me?